Responding to and recovering from emergencies such as the COVID-19 pandemic not only requires official government action, but also increasingly involves networks of volunteers who work in local communities. I'm Duncan Shaw from the University of Manchester. A spontaneous volunteer is an individual who is not connected with the existing official response organisations. They provide unpaid support to the response and recovery from emergencies. Their value has not always been well understood. They've often been viewed as a potential hindrance to emergency responders. Our research identified the potential of spontaneous volunteers to assist the public sector in local and national emergencies. Before the pandemic, we analysed involvement of spontaneous volunteers in flood emergencies in the UK. Our work identified improved standards and guidance for managing spontaneous volunteers as being crucial to a sustainable recovery from an emergency. We were invited by the International Organisation for Standardisation, more commonly known as ISO, to author guidelines on spontaneous volunteers in emergencies. We have been involved in implementing this standard in Chile and Argentina to create local and national government systems to coordinate spontaneous volunteers and deploy them to safely tackle emergencies. We worked with the UK Cabinet Office, which formed the National Committee on Spontaneous Volunteers, and our research evidence helped inform UK government national guidance on spontaneous volunteers, and that was published in June 2019. When COVID-19 hit, we received funding from ESRC to develop a framework for the use of spontaneous volunteers in recovery and renewal from COVID-19. We worked extensively with local governments to provide those partners with insights and guidance on designing their recovery strategy to reinstate local preparedness for future emergencies. We worked with the Cabinet Office's Emergency Planning College to support local government in their deployment of thousands of volunteers in local pandemic responses via a network of schemes run by NGOs, community groups and local and national government. For example, we worked very closely with Essex County Council and its volunteer response cell, which registered nearly 4,000 spontaneous volunteers to help support local welfare services.
It enabled us to form a completely different way of working with local volunteers in a way we hadn't done previously. In building on the work that we've done with Duncan and his team, that we are able now to target our resources much more closely to where risk and vulnerability are identified and make a tangible difference to people in their homes and to their local communities.
We used the lessons from our ESRC project to write the international standard on recovery and renewal from COVID-19. This was fast-tracked due to its global importance. This new standard led to the development of policies within international ministries and governments to support local government as they work through the most challenging of recoveries, including in Ramallah in Palestine.
The ISO standard fundamentally changed the way we approach our recovery and renewal from COVID-19 in Ramallah. The research of Duncan at the University of Manchester helped us to take an evidence-based approach. As a result, our recovery and renewal solutions were more holistic, supporting transformational change in Ramallah, and resulted in a quicker response and stronger social benefits for our citizens. The benefits of these solutions included better management of our public spaces, management of economic support grants, improvement in citizen communications, and effective use of our GIS mapping system during lockdowns to map essential supply points. A close working relationship developed between our working team, our city director, chief resilience officer, and myself as a mayor.